All right, good afternoon, everyone, and welcome. Welcome to our Back to Basics and Beyond webinar series. Today's webinar is on cardiac rehabilitation, what your patient hasn't told you. So for those of you who have joined us before, welcome back. And if this is your first time joining this webinar series, we're glad to have you. So this webinar series is Back to Baseline and Beyond, post-COVID management of patients with chronic conditions. The focus is on helping care providers across the continuum of care use lessons learned from the pandemic to improve chronic disease management and outcomes. So at this time, if you could please take a minute to enter your name and organization or facility and your role in chat, so that way everyone will know who has joined us today. My name is Carrie Finley. I'm with the Superior Health Quality Alliance Chronic Disease Management Team. And I'm very happy to be a part of the conversation. I'll also be joined by Mia Croyle, who will be presenting today as well. Next slide. All right, I just wanted to share some of our future topics that we have coming. As I mentioned, today's session is a part of a webinar series. Webinars are the third Tuesday of each month, and they occur at this time, so 12 o'clock noon Central or 1 o'clock Eastern, and then again at 3:30 Central or 4:30 Eastern. So you have two options to attend the series. And on this slide, you can see some of the future topics that we'll be discussing. We're very excited. We are finalizing topics for the rest of the year. But our next session's title is a little bit deceiving because it's a year in review, but it actually is going to be focusing on lessons learned to improve chronic disease management and outcomes. Also, please note this schedule could be subject to change as important time-sensitive information and topics come up, and we may need to be doing some adjusting at that time. Next slide. All right, well, as I mentioned, I'm very happy to be a part of the conversation today and share information about cardiac rehabilitation. Displayed is what I hope we can accomplish today. As I mentioned, I'm with the Superior Health Quality Alliance. I'm a registered nurse, and I'll be providing some of the information for this session. And then Mia Croyle and the rest of our chronic disease management work group will also be sharing information as well. Next slide. All right, we'll go back one more. Polling question. So we thought we'd get started with a polling question just to kind of get some information, engage where everyone is at with their understanding of cardiac rehabilitation. So Jenna, would you be able to display the first question for us? Yeah, so this question is, how often does your facility or organization make referrals for your patients to cardiac rehab? And your options are never, some of the time, most of the time, or always. So we'll take a few moments here for people to answer. All right, and we'll go ahead and we want to share those results. I think I can do that here. Okay, so if you're able to view those, it looks like we have some mixed answers across the board. Some of you don't have the opportunity to refer. Some of you do some of the times or most of the times. So I am looking forward to receiving or talking more about how that works for your organization throughout this presentation. And then I'm going to stop sharing on that one. And Jenna, can you share the next polling question, please? And that one is, how easy is it for your facility to make cardiac referrals? Very easy, somewhat easy, a little bit difficult, or very difficult. All right, we'll just give a few more moments to finalize those answers. And let me share that. And as you can see, actually, let me scroll down. I'm not sure if you're viewing what I'm viewing, but from those who answered, it's pretty consistent across the board in that it's easy, somewhat easy, a little bit difficult, or very difficult. So that is very good feedback for us as well as we move forward with the presentation. Okay, let's go to the next slide, Mia. All right, so I just like to take a moment to share a bit about the importance of cardiovascular disease and cardiac rehab. So cardiovascular disease, we know, is one of the leading causes of death worldwide, and also it's the leading cause of death in the United States. People of all ages are eligible for cardiac rehab, and displayed is a list of conditions most often referred for a cardiac rehab program. So as you can see, patients with cardiovascular diseases such as ischemic heart disease, heart failure, and myocardial infarctions are eligible, as well as patients who have undergone cardiovascular interventions such as cardiac angioplasty and coronary artery bypass grafting. We know that cardiac rehab programs aim to limit the psychological and physiological stresses associated with cardiovascular disease, reduce the risk of associated mortality, and improve cardiovascular function to help patients optimize their quality of life and decrease hospital readmissions. The current quality measures for cardiac rehabilitation suggest that a patient's time to enrollment should occur within 21 days post-hospital discharge, and that the patient should try and attend at least 36 sessions to receive the greatest benefit. The current goal for cardiac rehabilitation participation set by the Million Hearts Initiative is 70%. But in fact, individuals who complete a full program of 36 sessions have a 25% lower risk of death and a 30% lower risk of heart attack than those who attended only one session. It also reduces hospital readmissions and saves thousands of dollars per patient per year. However, we know that cardiac rehab is widely underutilized with a national utilization rate of only 25 to 50%. Next slide. I just wanted to take a moment to review the 4 phases of cardiac rehab. For some of you, this may be a repeat, but for some of you, this may be additional information that'll be helpful. And again, this is very high level, but the optimal cardiac rehab experience consists of, like I said, 36 one-hour sessions. And that includes team-based supervised exercise training, education, and skills development for heart-healthy living. It also offers counseling on stress and other psychosocial factors. Included in that includes medical evaluations, prescribed exercise, cardiac risk factor modifications, and as I said, education. The cardiac rehab team is comprised of heart doctors, our cardiologists, nurse educators, nutrition specialists, exercise trainers, mental health providers, and physical and occupational therapists. We have a very large team. And then each phase of cardiac rehab builds upon the previous phase. So in the initial phase, or the acute phase of cardiac rehab, this often occurs after the patient has experienced a cardiac event. So oftentimes this phase may start as soon as the patient is being in the hospital setting, such as the ICU or a cardiac step-down unit. So at this time, the initial goal of phase 1 includes assessing the mobility and the effects that basic functional mobility has had on the cardiovascular system. At that time, the patient and family will work closely with healthcare providers, nurses, and other therapists with the goal that appropriate discharge planning occurs. At that time, they'll also prescribe safe exercises to improve mobility and cardiac fitness. address any of those underlying risk factors that may have led to the cardiac event. And if an assistive device is needed at that time, such as a walker or a cane, they will ensure that the patient is able to utilize that and move around safely. And again, work with the patient and family to provide education about the cardiac condition they experienced and the expected benefits and risk associated with the cardiac rehab program. So once the significant healing has taken place and the patient is discharged home, phase 2 is the second phase of cardiac rehab. So in this subacute phase, or the second phase, this program typically continues at an outpatient facility. And this phase usually lasts from about 3 to 6 weeks and involves continued monitoring of the patient's cardiac responses. So another important aspect of phase 2 cardiac rehab is education. So they'll receive information about nutrition, proper exercise procedures, how to self-monitor their heart rate and exertion levels during exercise. And then towards the end of phase 2, the patient should be ready to begin to be more independent with their exercise and activity. Next slide, Mia. Phase 3 of cardiac rehab is the intensive outpatient therapy. This involves more independent and group exercise. The patient should be able to independently monitor their own heart rate and their symptomatic responses to exercise at that time. A physical therapist will be present during this phase to help the patient increase their exercise tolerance and monitor any negative changes. And finally, the final phase of cardiac rehab is the independent ongoing conditioning, which is ongoing. So if the patient has fully participated in the 3 previous phases, hopefully at that point they have good knowledge about their specific condition, risk factors, and strategies, and they're able to exercise independently and work towards maintaining optimal health. So while this phase is their independent maintenance phase, at that time the cardiac rehab team should still be available to help to make any changes if that need arises. Now, there's another thing I'd like to point out too in our changing world, that if patients are unable to attend in-person appointments or therapies, many facilities have a virtual option where they may be able to meet with their cardiac rehab team virtually, receive some of their education virtually. Also, I know some facilities are working on having patients track their progress, wearing wearable monitors. So those are things that can be done as well to make cardiac rehab more accessible. Next slide. Okay, so these next couple slides, I just wanted to talk about factors that might impact cardiac rehab participation and completion. Primarily, we know that participation does decrease with increased age. And also there is significantly lower participation in women compared to men. And that non-Hispanic whites do have a higher participation rate than Hispanics or non-Hispanic Blacks. And also there is evidence that participation is lower among beneficiaries who have greater than 5 comorbidities versus Medicare beneficiaries that would have 0 or 2 comorbidities. And my data is Medicare fee-for-service data, and I do have the resource listed on the bottom of the slide for reference. But overall, only 1 in 4, or I think the actual percentage is 24.4% of cardiac rehab eligible Medicare beneficiaries have participated in cardiac rehab. And we do know that marked disparities were observed. So despite the importance of cardiac rehab, participation still tends to be somewhat lower than the desired rate of participation that would be expected. Next slide. Other factors that may be barriers to participation are socioeconomic barriers such as cost, transportation, time commitment, caregiving responsibilities, employment, and distance to travel. We know that people who make more than $75,000 per year as their annual income are twice as likely to participate as individuals with annual incomes below $15,000 per year. In addition, we know that people who live out of metropolitan areas, so in more rural areas, are 30% less likely to participate in cardiac rehab programs. Another barrier is the psychological barriers. Grief and loss related to changes in health status, anxiety, and fear about health and physical activity can impact a patient's willingness to participate. There is considerable evidence that the heart and the mind go hand in hand. Thus, it's important to not only treat the underlying heart disease, but also to have an awareness and address those psychological and psychosocial issues as they do compromise adherence to cardiac rehabilitation. In addition, psychosocial factors such as anxiety, depression, loneliness also contribute to an increased risk prediction above and beyond the traditional risk factors. Underlying physical barriers also can contribute to decreased participation in cardiac rehab. Some of those barriers could be fatigue, shortness of breath, decreased engagement in activities of daily living and exercise. Those all contribute. Also, we know that a patient's perspective of cardiac rehab can reveal psychosocial barriers. For example, if the patient has had a bad experience with exercise in the past, they may be less likely to want to participate. And finally, motivation. It is critical that cardiac rehab begin at the onset of diagnosis. Studies have showed that the longer the wait time is following a hospital discharge, this can reduce cardiac rehab enrollment. So essentially, for every day that a person waits to start cardiac rehab, that person is 1% less likely to enroll. So in cardiac rehab programs, the emphasis really is on motivational factors to improve that patient's adherence. So next slide, and at this time, I'm going to hand it off to Mia to share the rest of our presentation.
Thank you, Carrie. So we're going to talk a little bit about some of the evidence-based strategies to reduce some of the barriers that Carrie just discussed, as well as others. The first one really looks at referrals. So when we think about barriers, we think about what are the barriers to a patient getting referred appropriately and in a timely manner to cardiac rehab. Then we look at what are the barriers to engaging at all, so going to that first appointment, the first few appointments, and then we look at barriers to completion. So the recommended 36 sessions, what are the things that get in the way of people completing their entire course of cardiac rehab? So the first strategy on this table talks about an automatic cardiac rehab referral system. So there are ways being explored to sort of automate that referral in the electronic health record so that when a patient meets that eligibility criteria, the order is put in for a referral to cardiac rehab. Another strategy that helps is having a designated liaison who helps educate the patient and facilitate that referral so they can answer questions, guide that process between if there's a gap between when the referral's made and when their first appointment is, sort of doing reminders or touching base with the patient, just to sort of be a bridge toward entry into the program. Some of these are a little more system level. So figuring out ways to limit or eliminate those out-of-pocket expenses for patients. This is a big barrier, particularly for patients in the lowest income level. The idea of having a copayment or a coinsurance can be a huge barrier to cardiac rehab. And then Carrie already mentioned that, in part spurred by the pandemic, we're now seeing exploration in the area of home-based or virtual cardiac rehab. So this would still be driven by protocols, and we would think about how is this managed in the home setting. And really, this is most appropriate for those low to moderate risk patients. The high risk patients really need an increased level of monitoring, at least initially. And so it's considered sort of less appropriate for them. Other barriers that have been found to have a good impact on the engagement and completion rates of cardiac rehab are having, the program have flexible hours. Are they available on the weekends? Are they available for later in the day appointments that might be after work type hours for individuals? So, and that's important, not just necessarily for the patients, but they may have a caregiver who needs to bring them to cardiac rehab, those kinds of things as well. And then Carrie did talk about, the importance of early appointments. So when we're looking at discharge planning, making sure that an early appointment is scheduled right away upon discharge, as opposed to sending the patient home with the referral and the idea that they'll get in touch with you to set up an early appointment, to set up an appointment. Getting that established as a to-do before discharge helps people make it to that appointment. And then again, this is sort of a higher level strategy, but really using performance measures for these referrals and enrollments, and monitoring those enrollment measures or monitoring those performance measures on a regular basis, so that we can do our quality improvement processes around that and help identify what are the particular factors that are impacting our rates and what are some strategies that we can try within our system. So, but if you're not measuring it, you don't know what you're targeting and what you need to target. It may be that you have a great rate in terms of patients making it to their first appointment, but see a more drastic fall off during that second, third, and fourth appointment, and having really low rates of completion. Well, that requires a different strategy than if you're having that phase one that takes place in the hospital, you're having good participation, but in that transition to phase two, a lot of people are getting lost in that gap. That requires a different set of proposed strategies. So just really thinking about how do we incorporate this into our QI processes and do what we know to do with our cardiac rehab rates. When we think about figuring out what's working and what isn't working in our processes, patient satisfaction is often something that we spend a lot of time and energy assessing around areas of care. However, when we look at the research, they have found that patient satisfaction really isn't assessed very frequently in cardiac rehab. There are a variety of different definitions of patient satisfaction, and looking at one measure, which might be how well is this program meeting the goals and the needs of the patients. And part of the reason why it's rarely assessed is there's really a lack of tools there just aren't a lot of research-based, well-validated tools that would be appropriate to use in the cardiac rehab setting. So we don't know a whole lot in general about what we find with patient satisfaction for cardiac rehab. What we have found in other settings other than cardiac rehab really strongly suggests that higher levels of patient satisfaction suggest that patients will utilize the service more and have healthier behaviors as a result. And then in addition to patient satisfaction, there's just that broader category of patient experience. So it may be critical to improving our numbers for us to find ways to really close that feedback loop with our patients, for us to understand better what their experience is like. And we know, like, you're already receiving some of that feedback in an informal way. Sometimes the most basic type of feedback that we get from patients is just that they vote with their feet, right? So if they're not coming back after their first visit, that's a point of feedback. It's not entirely clear what that means, but that's some feedback that we're receiving from them. If they're all dropping off after session 10, that tells us something. So we are already receiving that feedback. How are we capturing it so that we can utilize that feedback? So some particular ways that we could think about capturing the feedback would be follow-up surveys, questionnaires, interviews. We could think about a patient advisory group specific to cardiac rehab. So patients who've participated in cardiac rehab or maybe are actively participating in cardiac rehab, having discussions with them that help inform the process and the structure of the program. And as we think about that patient experience, again, we want to think about it at several different key touch points. So we want to capture the experience and the perspective of people who received a referral and never even enrolled in a cardiac rehab program. We want to capture the experience and the perspective of those who enrolled but didn't complete the program. Maybe they started, had a few sessions, didn't go all the way through. And then those who enrolled and fully completed the program. We find that capturing stories of cardiac rehab can be motivating. So hearing the good stuff is really important as well. It can be motivating to staff and providers, and it also can be a very nice picture for prospective patients, help inform them of what to expect and give them a sense of sort of positive hopefulness about their experience should they enter this program. So we have to share with you today a video that we've created with a cardiac rehab patient. Full disclosure, it's my dad. That's why I'm interviewing him, and it may seem a little informal, but that would be why. But really just showing how we could have a conversation about the cardiac rehab experience. And as you listen to this, I just want you to think about how might you use this information moving forward in your own program if you had this kind of a story from a patient in your program. Now, the trick is, I don't think I shared it with, I'm going to stop sharing for a minute because I need to make sure I share the audio. Okay. This should work. Tell me if you are not hearing the audio. I'm not sure what happened here.
Whoops, seems like it's stopped.
Hi.
Hello there.
So
There you
tell us a little bit about yourself.
Okay, 78 years old. A couple of years ago, I had open heart surgery to replace the aortic valve. The last 20 years, I've been baking. Before that, I was a teacher for 35 years and taught science, so I believe in science.
All right, I am gonna do this the old-fashioned way and just share it directly from YouTube. One moment, sorry. I feel like there should be some like, please hold music.
The Jeopardy theme.
Mhm.
I've been looking forward to seeing this video for a while, so for me, it's worth the wait. I hope it is for everybody else as well.
All right,
Yeah, there we go.
I think we're good now.
Hi.
Hello there.
So tell us a little bit about yourself.
Okay, 78 years old. A couple of years ago, I had open heart surgery to replace the aortic valve. The last 20 years, I've been baking. Before that, I was a teacher for 35 years and taught science, so I believe in science. And for that reason, I think I'm a pretty good patient in that most of the time I do exactly what the doctors tell me to do. And they told me in my exit interview, I guess it would be all called, or just the exit procedure from the hospital, that one of the things that would be a very good idea would be cardiac rehab. I had some experience with cardiac rehab earlier because my wife and I, went there as an exercise program because they have it open so that people can just sign up and go as an exercise, as a preventative thing. So I knew about the Stoughton Hospital cardiac rehab, went there for, as I said, exercise, and then it was time for me to do some rehab after the surgery, and they did a marvelous job. I was particularly impressed with how attentive they were to not just me, but all the patients, and how they monitored us very carefully to make sure that although we were supposed to push ourselves a little bit with cardiac rehab, we weren't pushing too much. So my experience was very, very good with cardiac rehab.
And you said that they told you that they first made the referral.
Yes.
When first time you remember was when you were leaving the hospital. Do you remember them mentioning it in the preparation for the surgery?
I think they mentioned, but didn't make any detail about it. After surgery, I would need to do some rehab. And they were very specific about it when I was doing the exit. The discharge procedure. They gave me the papers and told me that I couldn't do the cardiac rehab immediately, but in a while I would be able to do that. I forget what the time span was that I had to do a certain amount of healing before I could start doing rehab. But I'm thinking it was a couple of weeks before I started rehab after I got out of the hospital.
Okay. And I know that you were sort of working on stuff right away when you got out of the hospital. You
Yeah.
had certain exercises and things that they had you do.
Yes.
By the time it got to the point that you were to go to cardiac rehab, did you still feel like that was important and helpful?
Yes, and I understood that although I was doing the exercises they told me and the procedures they were telling me to help, very careful how I got up, but perceive, there were various different things they were telling me to do with some exercises and getting up and standing and all that kind of stuff. But I also recognized that the actual rehab for the rest of my body was going to need more than what I could do on my own. So the cardiac rehab involved various different machines that they monitored me on. Some were, simple rowing machine, not rowing, bicycle, standing, stationary bicycle things, and a treadmill. But they also had me do some upper body motion stuff without any resistance. There's a machine where you basically crank a crank, and that started off with no resistance. It was really just get all those muscles moving. And then as it progressed, they increased the tension on the machine. They had me do some weight work, very lightweight, but a little bit of work with weights, etc. So it was very well thought out. It was very progressive in that you always started easy and then progressed up to higher weights and higher resistance. And I thought it was very, very well done. The most important part that I was impressed with was that as soon as you got there, before you do anything, you were hooked up to a monitor, and they had remote sensors on you, put on your body, and all the while you were doing the exercises, there were several of the attendants, but there was always somebody watching the monitors for all the people in the room, and could see if anybody was having any difficulty. I never saw anybody have any difficulty, but I know they were there ready to intervene if there was a problem with the cardiac rehab being too much for somebody, or if they were doing it wrong, or just too much exercise than their body was ready for.
So that helped you feel really reassured.
Oh yeah,
working
I
out
knew
there.
that this was a good place for me to be doing it. I mean, I could have done all of those things at a different kind of facility, but every other facility I've been to, there are people around, but you're pretty much on your own.
Right.
At cardiac rehab, you're never on your own. They're watching you, they're monitoring, and they know they've got people who need to be monitored.
Right.
That they are, the position they're in after surgery or in their healing process means they need to be monitored, and they do a marvelous job of following through on it.
And was the cost for this, was that covered by your insurance?
It was all
Did
covered.
you pay?
I assume it was covered by my insurance because I didn't pay for any of it.
Okay.
So either there's a big bill sitting out there or it was covered, and I'm quite sure it was covered.
Okay. And so I think you already spoke to this a little bit, but what was it that kept you going? Like what, after you'd been for a while and you were feeling a little more, steady on your feet, like you've gotten some back, what kept you engaged and wanting to go back?
Well, part of it is that I knew that the reason I was feeling better was that I was following a particular procedure. And maybe I could have followed that procedure on my own, but probably not. Certainly not as confidently as I was with those people watching me. So I was very pleased to be able to go, and it was convenient, it's easy. I mean, I live in Stoughton, it's in Stoughton, literally 8 blocks away from my house, so it was no problem. But I saw in the class that there were people who were doing a fair amount of traveling to get to the cardiac rehab, and they were coming regularly too. That was also one of the nice things about it, because you were in a room with other people who were in the same boat as you were. They were doing the same thing for the same reasons that you were. And it was not a great friendship group, but it was a little bit of camaraderie, which was good.
Yeah. And so it sounds like transportation and getting there certainly wasn't a barrier.
No.
Did you experience any other barriers or anything else get
No
in the way?
barriers at all. There was nothing getting, well, what did get in the way was COVID, because before the normal routine was over, they had to shut things down. But other than that, nothing got in the way. They were very good. And they were very good about giving us instruction of what we should and shouldn't do on our own when it was necessary to close the facility down because of COVID.
Okay. And what would you say to someone who has been referred to go to cardiac rehab and they're just not sure about it? They're, it's going to be a hassle for them to get there or the time. What would you say?
Why not? I mean, you've gone through probably surgery. You've probably been in a situation you feel really bad after surgery for a little bit. You're feeling better. You're probably feeling better because of what they've done to you and with you.
Mm-hmm.
Why not continue doing what they're doing for you with them to make sure that you don't mess up, you don't overdo it, you don't put yourself in a worse situation than you needed to be in? It's just common sense. I mean, it's what smart people do.
All right. Thanks.
You're welcome. Glad to.
All right. So now's an opportunity to just have a little discussion. I guess we can start, there's some discussion questions on the slide, but I guess we can start with what stood out for you from that video, what things, and feel free, you can take yourself off mute and verbally chime in, you can type in the chat. But just what struck you, what stood out for you? What seemed noticeable or remarkable for you in that process, in that video? Sorry.
Hi, this is Linda from down in Louisiana.
Hi, Linda.
I think what stood out for me is the honesty that he was willing to share with you, to say, yeah, I could do this on my own, but going there is really going to keep me more accountable because they're going to see me or they're going to watch me, I think is what he said.
Yeah.
But I do think that it has been proven that, the group part, whether it's Weight Watchers or it's something else with, weight management or we've done the DPP program, and it has the classes that you go to and stuff for diabetes prevention with the pre-diabetes. The camaraderie that they feel with seeing other people, I think really contribute to the motivation and the willingness to kind of stick with it, because it's tough. It's tough, especially if you're having to go, like I'm in a rural area, but especially if you're having to go drive somewhere and, oh, it's raining outside and I gotta go. And, it takes a lot to keep the momentum going. And I think his honesty was very, very good and he was willing to share that with you.
Yeah. And, if there's somebody who's going to notice if you're there or not, you're more likely to go. So I think absolutely that group camaraderie and just, sort of a little mini support group. But also the fact that, in a regular gym, if you were working out in a regular gym, you might be with athletes way above you in terms of, where they are in their fitness level. And so being sort of in a group that's at your pace, there's probably some benefit to that as well. Thank you. Other things that stood out, other thoughts or impressions?
And just what he said to Mia about how there were other people there in his same situation. So it's kind of neat that he saw other people there that found it also important.
Yeah, yeah. Absolutely. You're seeing other people come back week after week or day after day, and that encourages you to do the same.
I like how he described the context of his experience and compared to what would be possible for other people too, and giving some perspective on that and saying how it was easy for him, or what he could imagine would be harder for other people. And his life history, I just makes me want to get to know this person more as a person, but also as a patient, and get to know more of our patients and their satisfaction like that too. Great conversation. Thank you.
Yeah. I will say it always feels very onerous to sort of sit down and have a conversation with the patient. Like, we're very task oriented, and we're in a very, healthcare is a fast-paced environment. And that was a 10-minute conversation. And I guess I invite you to consider, when's the last time you had a 10-minute conversation with a patient just about their experience, what's working for you, what's not working for you, what was that like? And really just, giving them a chance to share their perspective. Because there was just a lot of richness there that I don't know we could capture in any other way, other than inviting him to tell his story.
Mia, one of the things that I noticed, and that was the first time I had the opportunity to review the video, but he shared that he was familiar with the facility because he had been there before it was open to the public. And just thinking about barriers and level of comfort, that kind of resonated with me as an approach that can be used to make folks a little bit more familiar with the facility, so that if a cardiac event were to happen, they would have an understanding of where it was located, and what the facility looked like prior to attending. So that was a really interesting comment that he shared.
Yeah, and it's, this is our sort of local small town hospital, and they make their facility available. They call it their cardiac prevention program, and anyone who wants to can sign up. And I think there's like maybe a very minimal charge of like $5 or something, and you can go in when the exercise physiologists are there and use their equipment. So it does bring that familiarity, going somewhere that what it's going to be like, at least look like and sound like and be like, just takes that one layer of a barrier away. Absolutely. So I want to just sort of toss the questions out to you guys. We can use, the rest of our time in sort of a little bit of a mixed way. If you have particular questions that you want to pose, you can certainly put them in the chat at any time. But then there's also these discussion questions that you see on the slide. So what do you already know about the barriers that your patients experience in, it says getting to cardiac rehab, but I don't think the question is asking specifically about transportation, just, sort of making it there. Like, what's getting in their way of showing up for cardiac rehab? What have you found to be helpful to help patients overcome their barriers for you in your setting? And then what things do you do to engage patient and family members in giving feedback to increase accessibility? So any of those questions, a different question that you want to ask or pose to us or pose to the group, open to all of that. We've got about 10 minutes left in our scheduled time.
Feel free to unmute yourselves, raise your hands, or type things into chat too. Thank you, Dwayne. That is also helpful. I think something else here, if I can fill in some time here, or space rather. Your father mentioned, believing in science and his background in teaching and professional and otherwise. I think reminding people that they're supported and helping to make people feel comfortable with the idea of cause and effect and medical facilities within the context of understanding that there are people who don't necessarily share world perspectives can really, really help. Basically, we don't change our minds over facts. We don't change our minds over what's been demonstrated or not. We change our minds over how we feel and just even just trust in another person. So making sure we meet people where they are first can really help with opening doors, not only for us as providers or analysts or whatever our roles are, but also for communities. So like having that public building, having those preventive, those are key as well, but just in the way we talk to patients, making them feel comfortable and welcome and understood.
Absolutely. Absolutely.
And also making those adjustments. If someone says something that they need, asking first before we assume, and then helping to make those bridges and letting our patients see that can be really helpful, which is, easier said than done, but it's still worthwhile, even if small ways.
All right, well, seeing that we don't have any questions, I am gonna just move us along. So this was the slide for any lingering questions. If you do find that following this webinar, you think of some questions or have some things that you didn't want to ask on the webinar, but some questions do arise, our contact information for the team that puts these on is available in the slides. So you can feel free to reach out to us. And I do just want to share, these are some resources for cardiac rehab, talking about the benefits. The Million Hearts Cardiac Rehab Initiative has a wealth of resources. And then there's a document with some of the research documents that we use, some of the evidence that we presented to you. And then from Medicare, the conditions of coverage for outpatient cardiac rehab. So I think someone else is going to take over from here.
That's me. All right, we can go to the next slide. What's next? Next steps. Please, by all means, if you haven't already done it, register for our April 18th webinar. And here's the links for that registration. Also, please sign up for Superior Health Connect. I'll talk a little bit more about that, but there's a wealth of information out on Superior Health Connect. And if you have any questions, you most certainly can reach out to me. Here's my contact information for that, or if you're interested in a one-to-one coaching call. Next slide. Again, these are upcoming topics. So next month will be the year in review, and followed by the importance of hypertension control and stroke awareness, which will be in May. And then we'll be talking about chronic kidney disease prevention in June. Next slide. This is the information for Superior Health Connect. And this link will take you straight to that site. And I believe Nicole has also posted that in chat. So again, that's a great, wonderful shared learning environment with additional information out there for you to review. Next slide. And just to share some awareness about other initiatives we're working on. One of the initiatives is Food is Medicine. This is a great library of resources about the importance of diet, nutrition, and to increase our knowledge of food as medicine. And the link is displayed here at the bottom of the slide if you're interested in that. And also, Nicole will be sharing a link to the PDF of this presentation. So you should be able to access information from that link as well. Next slide. Another campaign that we're working on is our Shine the Light on Stigma campaign. This is near and dear to our heart. Words matter. So we're asking individuals and organizations to commit to changing the stigma around substance use disorder by accessing the links on this page. It'll provide you a wealth of information in regards to the importance of why words matter in regards to stigma. Next slide. Okay, so that is the conclusion of our webinar presentation for today. We're so very glad that you joined us. And again, if you have any additional questions, please feel free to reach out to us, and everyone have a wonderful day. We'll see you later.